Hi, you guys. Welcome back to Coming In Hot with Caroline. I just wanted to say again, thank you for all the love and support. Please like, review, follow, give us all the goods. We're here to help. We're here to just inspire and motivate you to get up and get dressed. So we appreciate you. Anyway, today's topic is so exciting. You guys know I love talking about women's health, women's well-being, how we can be the best version of ourselves. And there is answers and help out there. Dr. Taz is here. You guys, we are discussing the Hormone Shift. This book, I think, is going to be life-changing for so many women.
So.
It's for younger women too. And I think honestly, in my teens, I experienced so many hormonal changes and we were going through so much at home. And I do think that combination of like, I had stomach issues, gastro, I felt awful. I had the worst period cramps on the planet. And what was interesting reading your book, just saying how it really starts back there, like 13.
It does.
Okay, Dr. Taz, thank you for being here.
I'm
Welcome.
excited to be here.
And
Thank
you
you
look
for having
gorgeous
me.
in red because you're coming in hot.
I'm coming in hot.
But please, can you just, first of all, just touch base? I want to talk about your background and how you got into this, but let's just hit it hard with why 13?
That is the average pubertal age, or where girls really start to understand that they're having a period, or the period's even starting to have some regularity. Now, the age of starting your cycle is going down. I'm sure you've seen some of those disturbing reports. It was 11, it's coming down to 9. But I picked 13 because I think that's where we start to have awareness, at least, of what's going on. And if we can just educate our teenagers about what their hormones are doing, what their cycle means, what's healthy, what's not healthy, so much of what I see in the exam room could be reversed. I'm talking about mental health issues. I'm talking about gut issues, all the ADD, ADHD that, we're seeing rampant. There's an element of that. Then there are the more sort of obscure diagnoses that we're seeing, everything from PANDAS to OCD to like POTS and, pelvic congestion syndrome. All these things our teenagers are dealing with. We haven't even gotten to the other women yet. So I feel like in today's time, more than ever, where we are seeing diseases kind of showing up younger and younger, all of them, autoimmune, cancer, all of them.
Wow.
We need to start educating our teenagers, and we really need to engage them in this conversation. And they're hard. I've got two. I get it, and I know a lot, but I'm the least valuable person in our home, So we have to help them build that team that they can trust, because they really have to own their health. We have to get them to own their health.
I mean, it's like even in school, like education should be more shifted into, right? Not just talking about the ridiculousness of, like the sex ed, but you're like, what? It's like, what are they talking about? It's like, you're not actually talking about just how women should be learning finance and how to balance your checkbook. Hello.
Yep.
And boys should be in home ec. Sorry. But like what happened here?
Right.
But again, it's like talking about your health and how important it is. We go through so much, especially as young women, trying to figure out who you are, plus all these like body changes, hormonal changes. Do boys go through any of these changes?
They do. And, there's a whole separate story on boys and young boys and what's going on. The problem with boys right now is the estrogen that they are getting from their the environment, right? Like boys are starting to have a lot of estrogen in their system. They're storing estrogen, they're holding on to it. And over time, it's impacting their sperm counts and everything like that. But with boys, they always went through puberty. They always had the moods. I mean, we're used to all that, right? The mood and all those changes and things like that. But the estrogen component is putting them at a higher disease risk than it was even a generation ago.
Wow.
I feel like we need to check these things. We need to really engage young kids on what it means to be healthy. And then the other part of all of this, and this goes across the ages, this is not necessarily just the teenagers, is that the stress levels today, the cortisol that everyone's just like pouring out, right? Like I have a 16-year-old, like the whole college thing, the whole competitive thing, like all of this stuff, right? That is just intense. Constant and it just ramped up to a whole different level. And then they've got their phones and social media. So they always feel like they're not doing enough or good enough or pretty enough or whatever enough. All of that is additive to this conversation, so there's just a lot. There's a lot going on. I'm not trying to be a Debbie Downer by any means. I really want this to be more proactive, that like, these are the things we need to be thinking about, but here's what you can do.
And the truth is, I mean, I love when you say knowledge is power.
Right.
I literally say it every day. I don't know why we want to dumb down or not want to know. And I know we don't want to deal with things or confront things. But again, if knowledge is power and actually could help you feel better. Because again, it's just not all medicine and pills and Band-Aids,
Correct.
right? Because I know when I was feeling super anxious, the first thing they do is prescribe a medication.
Right.
And you don't really understand everything else that's surrounding you that
Right.
affects you, right? And I know that's like a huge topic, but okay, just give us a little background, because I know you struggled with your own issues.
Yes.
And that's really an understanding and awareness that you got. Can you give us a little bit about your background?
Yeah, I always say this was completely accidental. I'm a conventionally trained MD. I came out of my training practicing pediatrics, then went into the emergency room. I love medicine. I loved what I did. I'm like that high energy adrenaline junkie. So the ER was fascinating, right? You never know what's going to come through the door. You have to think on your feet, all of those great things. But the process of all of that, and I came from a very, very stressful home. But so like a stressful childhood home, a stressful journey to get into medical school, then residency, which back then I have a young sister who's 19, 20 years younger than me, and she's just finished up residency, and it's totally different. But back then, totally different.
It's a boys' club back then.
It was
I kind of feel like it's
partly
still is,
a boys'
or no?
club. I think the generation even before me probably had to deal with that more, but I think it was just the sorry that you're in the hospital for 3 days type thing. You know what I mean? Like you come in at like 6 o'clock in the morning and like 2 days go by and you're like, wait, like
where am I?
What day is it? Like, where am I? So that culture has changed very much. It was probably dangerous. So that's a good thing that it's changed, but that's what I was doing. And then I chose the ER as a career choice. So now I'm night, day, night, 1 to 1, 11 to 11, 12 to 12, 7P to 7A. So my sleep's all over the place. So what had been there before, the slow hum of like acne, mild hair loss, a little bit of weight fluctuations, but nothing major, now just went through the roof. And all of a sudden I've got like joint pain and I'm tired and I can't get out of bed in the morning, and I'm 20 something years old and I want to go out and I want to date, but I'm getting ready with like the lights off because I can see like patches in my scalp and like all this stuff. But like, here's the kicker. It's like, I know, again, you're in that position. I had a certain amount of information back then, but I didn't want to deal with it. I was too busy. I didn't want to deal with it. I thought it would go away. I thought one day I'd open my eyes and everything would magically go away. That's what you think when you're 20 something, right?
Absolutely.
And
or when
so,
you're a mom and you're just too busy.
Or you're busy,
right?
right?
You just
and you
ignore
have
things.
other things going on.
Yeah.
And of course it didn't go away. And it finally started, I was dating my husband and my mom was in my life. And it was just like, they both kind of sat me down and they were like, something's off. Something's wrong.
Really?
You
They
look
noticed.
different. You're acting different. This is not you. You need to go get help. And that started that journey of trying to get help in our conventional system, and was offered the anxiety medication and the depression
we all?
medication
Yeah.
and all the things. And then I think it was just a specific incident. Like it was an 8-month journey, roughly, of doctor's visits and trying to understand and no answers. And then I finally went to a big hair loss specialist because like that was my biggest like embarrassment. And he handed me a medication, said, you need to take this. If you don't take it, you're going to be bald in a couple of years. At that point, I'm like
goodness.
27, 28 years old. And so I was like, okay, fine, I'll take the medication. But it had side effects that caused me to, lose or lower my blood pressure. I had a syncopal episode, ended up getting into a car wreck. And so it's just like you start to look back and you're like, this is not working. This is not working.
It's like one Band-Aid covers one thing, but then causes another
exactly.
problem, right?
I'm like, what am I doing? And so that's where I like started to dig, and I just started to look for help and found all these sort of fringe alternative ways of thinking, holistic medicine, acupuncture and Chinese medicine. Back then it was like,
I was gonna say, you're a doctor.
I'm a doctor,
right?
I'm an
and you're
MD,
now looking at things.
and so these were not accepted things. They're way more accepted today than they were back then. And so, I just start my own journey, my own healing journey. And so I saw a Chinese medicine physician who told me I had very bad qi and I needed to figure it out. And I'm like, not sure what that means, but okay. And then I did the holistic medicine certification, which educated me about gut and nutrition. Never heard about any of that in med school,
Wow.
And then from there, you just want to learn, and you kept going. And so finally did the 2-year fellowship with Andy Weil in integrative medicine.
Wow.
And kind of had the pieces to heal myself, but then also to start looking at everybody else a little bit differently. And people would start asking me questions. So that led me down this whole, sort of complete transition away from emergency medicine and ICU medicine and all those things into holistic and integrative medicine.
I just love that women have so many different lives.
I know,
I'm
right?
listening, and it's just so funny because I'm like,
Right.
the fact that a lot of women think it's over.
Yeah.
And it's just, I just
not.
love when you say that, because you're like, you've had 3 different careers.
Oh, yeah.
And it's just
Yeah.
like you can keep finding new things that
Very
you're
much.
passionate about. And
Yeah.
that's what's just fascinating about that. Sorry, I
Yeah.
had to interrupt because I was like, that is just
Yeah.
unbelievable.
Yeah, very much.
But I think what's interesting is in that journey. So what were those first steps? What did you start to see that actually helped you? Like, what were you feeling and experiencing? Just because so many women are feeling so many things. What were you kind of feeling? And then what started to kind of work? What was that little bit of like, oh, wait, this might be...
That's such a great question. I think the fatigue, I'm such a high energy, some would have said annoyingly hyper, but high energy, hyper, honestly happy person. Yeah. I see the world as full of promise and hope. And that was changing. I was tired. I was fatigued. I was depressed, kind of like the world was gray, not bright and happy, And so I think to me that even more than the hair was a vanity thing. It really bugged me and embarrassed me, but like how I felt was worse because I rely on my brain, I rely on my energy. In the ER, you're on your feet, you're moving around, so it's like physical too, right? I was reducing bones. My kids like crack up when they hear this. I go, your mom used to do procedures. I used to like reduce fractures. I did all of that, but the energy component was a big one. And so as I learned more and actually worked on my gut first, I think that was the first piece. I found out that I and later my entire family learned because of my journey that we're all gluten intolerant. We're all kind of atypical celiacs. I share the story all the time. Like my father's only 5'3", but his brother's 6 feet tall. He was never diagnosed with this celiac gluten intolerance as a child, and that probably stunted his growth. Once I figured that out, that was the game changer because all of a sudden the energy's back. I'm feeling good. I am willing to take risks that I wasn't willing to take before.
What was the gut? What did you start doing?
I took gluten out of my diet.
That's it.
That was the number
alone?
one thing is to take gluten out of my diet. And then I think that allowed the gut to heal. And then I started to absorb everything else. I was very low iron too, by the way. And so as those things started to improve, the energy part started to correct itself. But the fallout was, as I learned more and got my hormones checked, that my thyroid was off. I have PCOS, which is polycystic ovarian syndrome. So I had high androgens, and then my blood sugar was off, and all of that was triggering a bunch of inflammation. So that took a while to piece together. That took probably another year to piece all of that information back together. But once it was there, the hair came back. Everything was better than it had been in years, probably better than early college, So the gut component fixed it, which the Chinese medicine practitioner led me to. Their whole low qi comment was like bad gut, bad liver. That's what he just kept saying over and over again. And
wow, that's
of
kind
course,
of incredible, though.
Well, I mean, Diet Coke, popcorn were my staples because they were low calorie and they were fat free.
But we love our popcorn and Coke.
That was my dinner, so it was just that really was the biggest game changer. And over time I had to go on thyroid. I never had to take any androgen blockers or any of like the spironolactones, or I never had to do that. Things came back on their own, but I just changed. And I think the people watching me saw the change. And so everyone around me is like, what'd you do? Like, what worked? Tell me, And so my husband, who's watching this off in the periphery, and he's off in school now, he's a dentist and doing his thing. He's just like, I think you need to do something with this, And I'm
got to share this.
I'm like, what do you mean? He's like, I don't know. He goes, you seem really passionate about it. Take the back 2 rooms. He was starting a dental practice. He's like, take the back 2 rooms. You don't have to worry about overhead, payroll. You don't have to do any of that business stuff. He goes, just see a few people, help people. He genuinely, those were his words, just help a few people. And so I was like, that's easy, and so I was like, I'll do ADR shifts. I'll work 1 day a week in this like hobby type practice. I was pregnant with my second. We had a 6-month-old. And
you were kind of a hustler.
All this is happening. Wow. I truly thought it was going to be a hobby. I didn't think it was going to be anything else. And then what happened was the same experience I heard over and over again, 20 times, 30 times, and sometimes worse and more devastating ways. And I think there was just this tipping point of doing this, and also me taking over my husband's dental chairs, which is a separate story. But there's this tipping point of we always take over. He's just like, she takes over everything.
I took over the closet.
I know, all of it. So the poor man. But there was just this tipping point of like, this can't be a hobby. Like, this has to to be a mission. And this can't be like, oh, go do this, and your doctor then tells you that all of this is wrong. So it's just, this has to be a one-stop shop. This has to be a solution for people and for patients. And I just committed. So my last ER shift was 2012. Never went back to the ER again.
Do you miss that kind of, I mean, I know you're so passionate about this, but do you miss the excitement, just because I know we have such different stages in our life, and
I think no, because did it, I'm so grateful for the experience. And, I run our practices, and we have very busy, big practices. And I think everything I learned there has enabled me to set the practices up for so much success from a medical standpoint, right? Like, when do you call it? What's like no longer going to work with certain things? All of that's been, I'm so grateful for the
quick
experience,
decisions you had to make. Yep.
I'm very grateful for the experience and for the training and for those nurses who treated me like family. They were so supportive and lovely. But what I do now, I feel like is such a calling. I don't know how else to describe it. That
I do get it.
That there's no turning back at this point.
Isn't it something for you? I know for me, it's like that feeling of, it's like you found this like secret sauce.
Yeah.
Not even a sauce, but it's like this secret that you feel so good that you want to share it with everyone.
Yeah.
And it is that feeling of like, it isn't over, and you actually can feel your best, and you actually want to scream it from the mountaintops.
It's like, I want this for you.
Yes, I want you to look and feel good.
Right.
Like,
Totally. I want it for you.
It's so true.
So, yeah.
Now, do you recommend, like, when you said your kids and you found out your whole family, were your kids starting to not feel well, and your husband? Because obviously they're watching you and you're feeling your best, but why? I mean, kids aren't going to stop gluten necessarily.
No. Well, remember, they were babies. So when I'm learning all this, like, I'd already been through my healing journey, then pregnant, and still in a learning. I mean, we're always learning. I still learn every day, but I didn't know as much obviously as I do now. And when my son was born, he was actually born with some GI issues that seemed to exaggerate over time, and there were some other contributing factors to that. But then we got to a point where he was truly failure to thrive. He wasn't growing. And everything we did, I would sleep with him like up on me. It was a nightmare. Like, some of those years I honestly just don't remember. But his story was also one of leaky gut, atypical celiac. And as he got older and we started pulling gluten away from him, his gut kind of same like me. His gut stabilized, and he didn't. So he was the one that was most dramatic. My daughter overall seemed to have, like, in Chinese medicine, we talk a lot about constitution. She seemed to have like a healthy, good. She wasn't sort of weak like my son was, but she seemed to have a very strong, healthy constitution until she hit puberty. And then she hits puberty, and it is a shit show, like literally mental health shit show, anxiety, focus, periods, acne, just all of it. And trying to help her when she's in this kind of like doesn't know what she's talking about phase of her life, and guide her. But basically, long story short, with her, she also has PCOS. I'm pretty sure she won't let me do the ultrasound yet. I need to get her to that point. She's 16. Pretty sure she has some low-grade endometriosis and stuff like that.
Yep.
And it manifests in lots of ways, and so we are trying to get her on that healing journey. My son's on board. He gets it.
Well, it's like when you don't feel well, I think, and then all of a sudden you feel well again.
Yeah.
That's when you're like, oh,
he is on board. Like, he's 15 now, and I'm like, you're going to go to college in a couple years. These are the things you have to watch out for. And he gets it. Like, I'm off. I need this. He'll come to me, Mom, I need this. Mom,
That's
I need
amazing.
that. He's totally on board.
I wish all our kids had this awareness.
I did too, but he got sick little, right? So he remembers, he probably has some memory of that. My husband's been interesting. That's been a harder one.
I mean,
love him, but that has been hard. He's just such a nurturer. He's like that guy that'll do everything for everybody else, but that has come to hurt him.
It comes with a price.
It comes with a huge price. So he took on all the stress. He started practices. We had a young family, has a busy wife. Hard to run practices. People are sometimes not who they are. He got betrayed a few times. Yep. And he ended up he wasn't taking good care of himself. And they have a strong family history of heart disease. And he would not follow up and do what he needed to do for that. So at 41, he had a heart attack.
Wow. Oh my goodness.
And we got very lucky. It was the night before we were supposed to fly to Italy for my baby sister's wedding. And he's starting to get pain. He'd had a few stressful events.
This is like your worst nightmare.
Totally. He's writhing around in the bed, and he's like, it's reflux. I'm like, I don't think it's reflux, you know? And so I turn the lights on and I'm looking at him and I'm like, he's like, what are you doing? I'm like, I'm calling the ambulance. Take this. I'm calling the ambulance. He's like, you're overreacting. He's like getting so mad at me, but then also like saying,
something's wrong.
Don't forget, this is here, like telling me where papers are. And I'm like, this is not happening. And so sure enough, you know, the paramedics come, they put him on a monitor. They're like, they look at him. They're like, which hospital do you want to go to? And, you know, luckily I walked home the next morning after that night and I'm like, this could have gone totally differently.
What a wake-up call. I'm
We
sorry.
could have been on a plane, you know, and this could have happened, and an international flight. So his healing journey has
so
been
overwhelming to think about. Honestly,
different,
right?
I feel like I want to do something for men. I've spent so much time in the women's health space, but we as women, and we have to own it, and I made this mistake and I hope other women don't. I felt like as busy as a woman I was, with as many balls in the air, and our children, remember, we're 15 months apart, we're starting practices, we're working jobs outside, we were slammed, and I felt like I was doing everything I was doing. And I think for a period in our marriage, was like, I can't be responsible for your health too. That's how I felt. I was like, I am barely holding it together, and I can't be chasing you to do all this stuff too. Like, you're a grown man. You should be able to do this. That was the wrong thinking. And for every woman out there, I get it. I get it that they're adults, and I get that. But at the end of the day, what I have observed over and over again in my own personal life and in all the families that I deal with, we run the family, we run their health, we run their mental health, we're responsible for the appointments. Don't be mad about it. That's just the way it is. It's never going to change. You know,
I could like tear up, honestly, because I think that's something that, you know, I've talked about in marriage, that, you know, not always men are always happy, you know,
Right.
that like they're not always doing what they want to be doing. Like
Right.
they have to support a family. They have to
Right.
live
It's
up to your
hard.
expectations
Yeah.
and the things that you want and the
Right.
dreams that, and, you know, there was a time where John and I, again, it's like, where I'm home. I was like you know, I'm an older mom. I
Yeah.
had kids back to back.
Right.
And you were drowning in it. And then my dad gets Alzheimer's, you know, I have to take care of my mom.
Right.
And you are like drowning in these sandwich years.
Totally.
And you don't forget that your husband, like I remember John, you know, not feeling well. He got these crazy allergies. He's never sleeping. He's drinking Celsius all the time to just try to stay awake. I
Yeah.
mean, is he going to go get checked? Probably not. Is he going to go get those heart checks? Like, these guys just don't ever want to
don't do
admit
it.
that that anything's wrong. I'm take care of it. And the truth is, we're all susceptible to something happening. And like, why are we waiting to the last minute to make sure that our health is wealth at the end of the day, right?
It is. And the health of a family.
Yeah.
I walked home that day and I'm like, what if I had to go to the kids and tell them something else, you know? So I think
That's interesting. What would you start to work on for men? Because I actually do think, you know, I think women are going to hate us for this one.
They're
because
going to hate us.
Because I agree.
I hated myself.
I
Don't
did
worry
too.
about it.
I said I understand. I actually said, I was like, I understand why
Yeah.
there's so many marriages and so much divorce because
Yes.
of menopause. I honestly was like,
Totally.
menopause is destroying marriages.
It is.
Because I was
It
like,
is.
ladies, when they say you're on your period and they
Yeah.
say, you know, like a negative, I was like, they're not wrong.
Right.
Like, we do act crazy.
We
Like,
do.
We do.
We do.
And
Yeah.
it does hurt marriages. It does hurt families. Like, I look like the Hulk one day. Like, I was like a lunatic.
Yeah.
So emotional, hysterically crying. I don't even know what I was so emotional about, to be honest
Right.
with you. And you don't feel like yourself. You're gaining weight. You're sweating. You're losing hair. You're turning gray. I mean, you're just like, I'm going to have a nervous breakdown.
Yeah.
And then you're a completely different person. And you wonder why this person doesn't recognize
Nobody
you.
wants to be around, and I know everyone's going to hate us for this, but nobody wants to be around a lot of negative energy constantly, right? None of us do. And so our first responsibility is to ourselves and trying to figure out, you know, in fact, I was even reading, this was not related to menopause, but it was related to just speaking, you know, podcasting, what we're doing here. And it made this very simple statement, whatever I was listening or watching, I can't remember, but it was just like, whatever energy you bring in is the energy that's going to play out in whatever you do, right? So
Absolutely.
if I came into this room exhausted and like having had 4 cups of coffee and a bunch of junk food this morning, our conversation probably would have been different. So same thing at home. You know, if we are not kind of centered and in a good place and understanding what's going on with our body and taking care of our bodies, we can't play these roles of wife and mom. We can play them, but probably not
At our best levels,
at our best
right?
level, right? So then we're flying off the handle, or we're not having sex, or we're depressed, or we don't want to go out because we don't feel good about how we look. And
Or you're freaking out about whatever at home that's not really that big of a deal,
not that
right?
big of a deal.
Nagging, and like, it's true.
Yeah, and you can be doing that at work too. I've seen women blow up their careers too over this stuff. So I think our first responsibility is to be an advocate for ourselves and understand what's happening. Then I think we start to look at the people immediately around us and be like, okay, what do I need to do for you? So like even for him to this day, I make the appointments, I schedule the lab draws, I have to drive that, you know, because
but as long as he's willing to go,
he's willing to do it, and he understands all of that. But again, and guys have this thing, like this ego thing, I think, is like, it's always like, well, I want to do, and I hear patients do this too that I see. They're like, well, I'm going to do those labs in like 6 weeks because I'm going to be perfect over the next 6 weeks, and then I'm going to do my labs. I go, that's pointless. I go, we just need to see where you are. We just need to see where you are, and then where do we need to pivot from where you are today? I go, if we're going to keep waiting for this point of perfection, like time goes by,
right? Right.
So, but
the sooner the better. Always,
sooner the better,
right? And always, like, if you feel like there's something off or you're not feeling your, like, it is always worth checking. Right. Always worth asking.
Very much.
Okay, I want to ask for now. You were mentioning your parents, and my home was really, really disruptive. Honestly, my dad would cheat, and unfortunately, my mom was, they came here from, Venezuela and Cuba, and, they're immigrants, and they had my sister. I was born and raised here, but, it was very, very difficult. Yeah. And I saw my mom, I watched her go through these fluctuations. Like, us as kids had no understanding what was going on, but she would I will never forget the day she literally tore her shirt in half, and I am not joking. Like, it was terrifying. Probably going through menopause, didn't even know it, had no idea what that was.
Right.
And the toll that kind of takes on the entire family. Cause I was like, why wouldn't you want a happy mom? At the end of the day, I always say, like, why wouldn't you want your mom looking and feeling fabulous? Like,
right, totally.
Like, that trickles the entire household.
Totally.
It really does.
Yeah.
What was it like in your household? Because I feel like it did. Mine was there was always screaming, yelling. We were always scared he was going to walk out. I felt so much anxiety all the time. And I was also the one that had to keep my mom happy. Yeah. Because I had to be the happy one.
You were the
youngest.
Youngest. Okay. So I'm the eldest of 3 girls. And our home was chaotic. And it was chaotic for a number of different reasons. I am from an immigrant family. They both came from India. It was an arranged marriage. They probably shouldn't have been together. They're divorced now, all that other stuff. So whatever conflict they had with, not being compatible was one issue. But the emotional lability is probably the best way to describe it. There were high highs, there were low lows, there was a lot of throwing things, there was a lot of fights and anger. Yep. There was no cheating, but it was like each of them did not have emotional bandwidth. I think my dad suffered from depression, and I think my mom was bipolar, but she also had hormonal imbalances that were never diagnosed. She had endometriosis, she probably had PCOS, all of these different things. So she had no advocate for her. She had no family here. She had nobody here, right? So it was me, I was as the eldest, I love them and I have good relationships with both of them now, but like I was the parent. I was the parent in that family.
I was the parent to my mom too.
And I was the parent to my sisters, and I had to maintain emotional stability while they were spinning, literally spinning. Same. And so I always had, we were always walking around on eggshells, always, all the time. And so that's the state of mind in which I left and went to med school or college and then med school. But here's what happened while I was gone, because when the parent's gone, it's like chaos ensued. Oh my goodness! And a whole different level. And so I don't want to take time to go into all the details of all of that.
I think so many people are living this. The most DMs I get is like, oh my God, my family was the same, or my mom, or I was the caretaker. I was the one. I was like, my mom would cry to me. Yell at me, tell me how my dad doesn't love us. He's he's going to leave. He can't leave with this
constant.
hooker. I mean, you're like,
Yeah,
oh my
just,
God, Mom.
It was constant phone calls, right? I'm
Yeah.
at college, but constant phone calls, constant this, constant that. And then the minute you try to assert your own independence, again, this is an immigrant Indian family. So then it's a lot about, remember, in Asian families, it's a lot about the family's more important than anything that you want individually. So you're kind of brainwashed a little bit to be like, well, this is what I'm supposed to do. So, but the minute, like, they would disown me, they would take financial, I mean, it's just chaotic. They would take financial support away. But meanwhile, they were having their own chaos. So it got to the point of so much destruction that it started to financially impact the family. The house went into foreclosure. My father declared bankruptcy.
Oh, no.
So I'm coming out of residency and I'm pulling up to our childhood home, which is a beautiful home in a nice area in Atlanta. And like the yard is overrun. There are rats in the home. It was like everyone had checked out.
Yeah.
And my little sister at this point is like 6 or 7 years old. And she's like, it's really hard when you're gone. And I was like, oh, fuck.
no.
I go, I have to come back, So
Yeah, you
I had to
can't.
come back,
Yeah.
So I came back and I dealt with all of it. But no surprise then that I have PCOS or that, because that
It's like
gene
each generation.
turns on with
Right.
the cortisol. So that's kind of what I came from. So the health of a family is so important to me because I've lived in a bad one. I've lived in a good one. Even in a good one, you see how people's health and issues will impact the dynamic in the relationships. And then I sit with patients all the time who are in different family constructs. And whether we like it or not, it directly impacts our health.
It really does. And it's funny you say that too, because it's like, especially, the mom, you are this person that is supposed to be taking care of everyone
Right.
else. And we forget to put the oxygen mask on first. I know
Very
I love
much.
saying that, but it's like, that's what they say on the plane.
Yeah.
You're supposed to take care of yourself. And imagine if we didn't keep inheriting our mom's stress. Like imagine if we actually
Right.
took responsibility, actually took care of ourselves. And imagine we didn't pass that on. And I always say that with my
I love
kids.
that you use that language. I love
It's
that.
like so true. I mean, I literally look at my kids and I feel the same. I'm like, the way I felt in my own home and the way I feel in my home now,
Right.
there is such a difference where I was always trying to escape my home and my kids, I can't get them out of the house. Like I'm
Yeah.
always like, wait, do you not have a
yeah.
play date? Like what's
Yeah.
going on? And
Exact
it's like,
same.
there's the calmness
Yeah.
and like they're healthy, they're good. And
Yeah.
of course we're going to have issues and problems. My kid, I mean, Finn had so much anxiety. He had a tick,
Yep.
eye twitch,
Yep.
had a fake cough. We had to deal with all that anxiety and stress. He skipped a grade. So it's been brutal.
Right.
I'd be
Yep, yep,
lying.
yep. Uh-huh.
But that's somebody that now I'm thinking I need to really focus on the health aspect of it.
Right.
And like, what is he eating? What is he doing to help him?
Right. Calm that nervous system
Calm that
down,
nervous system.
know,
But again, it's
so-
just being able to create a home, where we're taking ourselves accountability, taking care of ourselves and not passing it on.
Yeah, but are we like kicking ourselves in the? So my daughter's now looking at colleges, and
God, no. What?
She's like looking around, and she's like, And she's like, "Are you sure stay-at-home daughter's not an option? It's a career choice."
Oh my God.
Did I do my job too well? So
You're like, no, sweetie.
and my sweet husband is like, "Absolutely, you can stay here." I'm like, "Shut up!"
You're like, no, go away.
anyhow,
You need to head out into the world.
So yeah, just maybe be a little bit careful with that. It's probably
Okay, so let's discuss about the hormone shift. Okay,
Yes, let's
obviously,
talk about
all of your work, all of your expertise, at some point, you're hearing all these stories.
Yeah.
You've got to share them at some point, right?
Definitely.
How did the book come about? I know you give us the tips. What are those? Can you give
Yeah.
us? And I know there's a strategy for a reset at the
Right.
end. Can you talk about the book? How did it come about? And
Yeah.
what's all the goodness in there?
Yeah. So, 15 years sitting with patients day in and day out, listening to these stories and seeing the patterns, right? Seeing how women, first of all, of all ages, and then especially women going into their 40s and 50s, were complaining about the same things over and over again. So the hormone shift is really born out of my personal story and then the stories of all the women that I've been seeing for all these years. But then Gwyneth and I were having a conversation and kind of commiserating. We're sort of entering the same phase kind of at the same time. And that conversation, I think it was a podcast we did, that conversation went nuts, and she actually was the one who motivated me. She reached out and she was just like, I think we need to write about this,
amazing.
And so that's really where the book came from. I don't think I set out necessarily to write this book, but I'm so glad I did. And I think what I wanted to do in this book, and it's really interesting because there's been so much hormone conversation, while I was writing the book and after the book came out too. And what I wanted to do is really present that well-rounded 360-degree approach to hormone health. We've got a lot of people talking a lot about HRT. We have a lot of people talking about, like surgeries and procedures and all this other stuff, but nobody really putting the whole spectrum of health together in the context of hormone health. And so what I wanted to do with this book was take everything that I had learned, right, over the years of both studying and working with patients and things like that, and be able to distill it down into a strategy. And I find myself using that word a lot. Like, we need, just like you, whether you run a business or a home or whatever you do, you have a plan, you have a strategic plan,
Yes.
right? And so I wanted people to have a strategic plan as to how to take care of their health and their hormone health, rather than sort of presenting with like, okay, I have this symptom, and this symptom. Okay, here's your estrogen, here's your progesterone, you're done. I wanted to widen that conversation a little bit, because what I understand with the way the body works and with the way health works is that we're not that simple. It's not just take a hormone and everything's okay.
And we're all different. Right?
And we're all very different. We have different genetics. So we're going to use those hormones differently. We're going to store them differently. And, if we have things like chronic inflammation or obesity or, insulin resistance or things like that, those need an approach beyond just a hormone approach, So I wanted to merge what I've learned through Chinese medicine and Ayurvedic medicine and nutrition and homeopathy with what I had learned on my own through integrative and functional medicine and conventional Western medicine, and be able to present everybody with like, here's the toolbox, work your way through it. Different points for different people depending on where you are. And so for some people, all the natural stuff is enough. They do the right diet, they go on a few supplements and herbs, they correct their nutrient deficiencies, hot flashes, night sweats, energy, all that's taken care of. For others, that's not enough. They have to move into maybe the next pillar. And sometimes that's still not hormones. Sometimes that might be acupuncture, right? Or medication or pharmaceuticals. And then they consider hormones. Others are in such a mess that hormones are their first stop and they back their way into all of this. But what we don't want to do right now in today's landscape is we don't want to be as dismissive of hormones as we were with the Women's Health Initiative and all that other stuff. But we also don't want to be like, hormones are the answer to everything.
Right.
I wrote the Hormone Shift. Hormones are super important, but they're important in the overall context of your health,
Right.
So,
because the gut, you were saying, it's like all the different things that affect you.
Correct.
Right.
The gut, the liver, inflammation, a word called oxidative stress, which is how much energy each of your cells have, are going to determine what your body does with hormones. So we can put a hormone on you, but if all this stuff is still happening, right, that hormone may not serve you well.
Right.
Right. But if you're in a good place, that hormone's going to do the right thing.
How do you feel about HRT?
I
took
love
any.
it.
See, I didn't take any.
Yeah.
How do you feel about it? I feel like there's like, everyone says you're going to get cancer, you're going to get breast cancer.
So
I mean, it's like,
interesting,
it really is. You hear, it scares you.
Yeah, I just came from interviewing one of our breast cancer specialists, and it's interesting to hear everybody's perspective on it. I can tell you what mine is. I think that, yes, there is a connection between HRT and breast cancer, but the connection is very small.
Okay.
And what I just learned actually today is that connection to when you get cancer from HRT, if that's really the cause of your cancer, those cancers are benign. They typically are very easy cancers. They go away easily, that type of thing.
Okay.
They're not the scary ones like the ones that are not estrogen related. That's the breast cancer specialist's take on this. What I'm seeing in the exam room, right, because we have the liberty and the luxury of doing a lot of like really in-depth work with patients, and we spend a lot of time with patients, we can identify the genetics behind which estrogen in high doses does not work well. Those patients gain weight, they have more inflammation, they actually get more insulin resistance. They are the ones that tell me they get puffy or crazy, they feel off, right? So what we have to do in the exam room is individualize the hormone discussion to the right patient, right? So if you have certain genetics, you can still do hormones, but the doses have to be fractions of what's conventionally prescribed. If you don't have those genetics, you could probably do the standard doses of hormones, but we still need to monitor and understand what the body's doing with them. And so I think, again, where, while we swing pendulums all the time, in medicine, the truth is in the middle. And that holistic approach is the only way to do it in a very strategic, methodical, well thought out way. But it requires, patience on both the part of the practitioner and the patient so that you guys work together as a collaborative team to get to that right place. So I like hormones, to answer your question. Women should not be deprived of hormones and live the lives maybe that our mothers had. Right? What if they had some gentle hormone balancing that kept them kind of even? Or, the other thing they do is they just give clarity. Like what if my mom had clarity to know what her next best step is rather than flailing around in this like emotional storm that she was experiencing?
Well, I don't know anyone who's not on an anti-anxiety.
That's problematic.
I'm not joking. I mean, I'm being brutally honest with you.
Well,
and so I'm like, and you're like, you do start. I mean, I was taking it for sure. And I was like, because the anxiety was terrifying.
Right.
Like panic attack feeling.
Yeah.
So you can eventually go off all these things. And everyone listening who is maybe taking something and you just are like, I hate taking something. There's obviously side effects to those things.
Right.
You can get off of these things.
Right.
Right. I mean, I think that's what the book is trying to tell you is that there are other options.
There are other options. And here's the other thing I would tell everybody too. It's not all or nothing. Like, I feel like there's a lot of like this noise I hear in practice of like, I don't want to go into pharmaceutical. And then there's a lot of like, don't take me off my farm. Like, I feel like people are in these two camps,
Right.
But you can, by doing the right work, still be on your anti-anxiety medication, but instead of needing 30 milligrams or 20 milligrams, you can go down to 5.
Right.
And that minimizes the side effect profile, that makes the medication a little bit safer for you and your body chemistry. So it's not that we necessarily think everybody should come off. It's just that those medications are Band-Aids for the true chemistry that's happening underneath. And while everyone should be living their best quality of life, so if they've got anxiety, they may need an anxiety medication, but they should also be looking a little bit under the surface and saying like, well, what are my hormones doing? Am I just low in magnesium or a B vitamin, or, is there something else going on that's triggering this anxiety?
Which also can be like caffeine, too much caffeine,
alcohol,
like something you're taking, right? Like
sugar, all of
could
those
be other
things.
things.
Yeah, totally.
And that's what I think is fascinating. I don't know. For the typical woman, right? I know we talked about this. The age is really shifting.
Yeah.
Right? We don't even know. Like everyone
Right.
says menopause was 55. It's the golden girls. It's like
Right.
an old lady.
Right.
You know what I mean? So
Right.
everybody I think thinks, oh, it can't be me because I'm
Right.
not old. Well, I guess we always think we're not old.
Totally.
But
right.
what is that? What is the changing age? You were saying you're even seeing cancers younger. You're seeing everything younger. Can you talk about this shift in age and what are those signs that women should be looking for?
Definitely. So true menopause is shifting down a little bit. It used to be 55-ish. Now it's gone down to about 52, 51. I think the thing that we're seeing more of that's a little bit concerning is the early menopause, which is happening in the late 30s, early 40 group. I'm seeing more of those patients as well. Lots of different reasons for that. Stress might be one, and the environment and the toxicity that we have, food quality, those could be others. But regardless of your age, no matter how old you are, I think when you start to see a constellation of symptoms, right? You're having hot flashes, night sweats, you're gaining weight, your energy again shifts down, you're having mood swings and you can't explain it, right? There's not an obvious trigger. You didn't, nothing, there's nothing you can put your finger on. More than likely it's hormones, and more than likely you're moving towards menopause. Menopause and perimenopause, there's a whole classification system for them, and there's early and late, there's all these different signs with each of them, but you may be somewhere in that spectrum, and the earlier you check, the better. A lot of when we look at the science versus the practice, the science is continually suggesting that there are windows and opportunities to start things, to reverse heart disease, to improve bone health, to improve brain health, some of these other things that are hormone fallouts. And so I think the earlier you engage in like, okay, wait, there's a change, what is happening to me? And then you go and try to understand that, the better, because if you're going to start hormones or hormone replacement therapy, it's actually better to do it earlier rather than later.
Right.
You see more benefit, So that's why I would encourage you. One of the classic hallmark signs I feel like is the belly fat. I feel like
the weight gain is
women-
insane.
Yeah, and it's belly fat particularly,
Literally.
you know. And I think what's happening there, that's your first kind of telltale sign, because as estrogen and progesterone go down, blood sugar and insulin go up. And that's why everybody starts to see this shift in body composition. And so, you know, as I do this more and more and more, I'm like, that's the universal one. That's the one that, like, not everyone has hot flashes. Not everybody has night sweats, you know. Not everybody has sleep disturbances or low libido or things, but it's like that belly fat that seems
That's like
to be
everyone gets it, right?
universal.
Okay.
That seems to be the one. And then this one probably right after that is the anxiety and depression.
Right, those like
know.
palpitations and like
The heart
panic.
palps and
Yep.
the panic, or just the low mood, like I'm not happy. That's when people blow up their marriages, because like, I'm just not happy, I'm not fulfilled. And they think it's the person or the construct, but it might be us.
100%.
might
Sorry,
be us.
ladies.
I know.
It's me.
I
I'm the
know.
problem.
It might be us. So get it checked before. So I always tell patients when they tell me I'm getting a divorce or I'm doing whatever, I'm like, can we wait 90 days? Let's just get everything balanced and then let's make that decision.
I think it's so true. It's like wait
So-
to you, because even now where I've been actually feeling my best
Yeah.
and really making an effort to, you know, really every single day, just
Right.
like, okay, how am I going to feel my best? But it's interesting. There's still like every once in a while that little bit of a shift.
Oh,
where
yeah.
There's a couple days where you're kind of like, you do feel hormonal.
Yeah,
like, and now
totally.
I'm so aware of it.
Yeah,
That I'll be
same.
like, John, don't, not today.
Yeah.
Not today, Satan. Not today. Like,
Today's not a good day.
so it's like you
Yeah.
start to feel those little symptoms, and that's what I think is incredible about the awareness, because then you can communicate it.
Totally.
Right? And then you can actually be on the
Totally.
same page and
Yeah.
you kind of understand.
Yeah.
What is that what are the questions that somebody should ask first for the doctor? Because I feel like they do blow you off. What kind of doctor should we be going to? Because we need more of you.
I mean, I feel like those of us in the integrative space and the functional medicine space are more open to this deep dive into
Okay.
hormones. I feel like just that's a good blanket statement. A part of my mission is to create more, right? Create more,
Yeah.
get this going, you know, in different ways. But I do think your GYNs are helpful. I do think they're a little kind of locked into that, like, here's the only way to treat hormones. But I do think many of them are engaged, and there are a lot of them that have pursued some of this additional training that, you know, are great to engage in this conversation with.
Okay,
so I
that's
do
good.
think they're your two best bets. I think the endocrinology community is still a very academic community and very tied into research, less so into like practical applications for women and women's health. So I would say a good GP that's trained in some of this stuff, an integrative medicine, functional medicine specialist, a GYN who can kind of look at this kind of from a holistic perspective. And maybe it's all of them and they're working together as a team, you know.
Right.
Those are all great options for pursuing this. And what I intended to do with the Hormone Shift is to equip you to go into your doctor's office, you know, to get
Right.
the things you need. So there's a lab order in there. These are the labs you should check. These are the ranges that I typically like. And a collaborative medical provider will work with you on that.
How do you feel, doctor, really quick about Mounjaro? Because I know,
Yeah.
you know, so many women now, I have tons of friends that are really benefiting. I know it was like an outrage at the beginning and
Right.
everybody was freaking out that about weight loss, but I've been actually hearing a lot of positive things.
Yeah.
And just hearing that like it's good for anti-aging and for
Yeah.
your blood sugar and all these things. Do you have just as a woman, doctor, what is your opinion on it?
Yeah, it's interesting. I'm for these things, but in a little bit of a different prescribing pattern. I like to microdose it, and I like to do it what I call on a bell curve, where I'm not saying that you're going to be on it forever, but women really struggle with weight when they get into sort of their 40s and 50s. And I think so we take a strategic approach in practice to this. I'm not against it by any means, but the strategic approach is more, I need your gut to be healthy. I need to make sure your liver's cleaned up. And then I need to make sure like markers of inflammation are down, your nutrients are optimized. If we can accomplish those four things, then oftentimes we will start a microdose of that if the patient's stuck, because it does bring blood sugar down and it balances that fundamental issue that all women, every single one of us, experience in perimenopause and menopause, which is insulin resistance. So it's dialing down the blood sugar issue, it's dialing down the insulin. That in itself is anti-inflammatory and anti-aging.
Okay, that's what that means. Okay.
So it's interesting, after the conversation I had this morning with the breast cancer researcher, and we were talking about, one of the things she brought up was that one of the biggest drivers for breast cancer for women is actually obesity and insulin resistance. So in my head, I was sort of thinking like, in the order of frequency when we give things to patients, right? If you were sitting in front of me as a patient and I'm trying to make these clinical decisions, do you need hormones first, or do you need a GLP-1 or some sort of insulin regulator first?
Right.
Based on what I heard today, it's actually the GLP-1 should come first, the hormone should come second. Because, kind of what she was saying is that the research is showing we don't really want to give hormones to a woman that has a lot of like blood sugar instability and insulin instability. It can actually be pro-inflammatory rather than anti-inflammatory.
Interesting.
So for me, from a practice standpoint, I'm like, that's super interesting. So we were kind of doing that anyways in practice, but maybe not.
So if it's not really working for you, it could be more
it might be more harm than good. Right. So that brings us back to the GLP-1s. There are women in practice who are superstars, and they have given up sugar and alcohol and every processed food out there. In fact, by the way, our processed foods and meats with the glyphosate. Glyphosate acts like a pro-inflammatory estrogen.
Ew.
So it's a big part of the weight that we're seeing across all ages. So when patients like kind of really buckle down and they take all that stuff out, and then they're like working on sort of a liver gut cleanup, they're losing weight without GLP-1s and without all this stuff.
I was when I started I didn't drink alcohol because the anxiety was so bad. I just wasn't feeling my best, and it wasn't like but I was like, how you have a glass of wine at night every night.
Right.
But when I just did not drink alcohol for a year, bloating's gone. You feel great.
Gone.
I mean, I hate to say it because, of course, it's fun to have a drink. But yes, does it help? Let's be honest.
Yeah,
ladies.
it totally. And even like for me, if I go off track at all, like it's instant. Like you can probably look at my videos and like, oh, she probably had a drink last night, because you can literally see the belly come back out. And that goes with like my PCOS and my chemistry and all. So I'm not surprised by any of that. But it's hard to be that heroic with everything all the time. And so that's where GLP-1, I'm not against it.
Okay.
I was very against it.
Right.
I kind of was just like, this is stupid. People have 10 to 15 pounds to lose, and now we're going to inject ourselves. So Ozempic, I see more side effects for sure.
Okay.
But the Mounjaro, I feel like, is doing a little bit better.
And I've been hearing about this microdosing.
Yeah, and the microdosing is what I like.
Really?
Yeah, I like that. I don't like our standard doses. I like our microdoses because it's just kind of dialing down that sugar, and then it's easy to come off of it too.
So it is easy to come off.
You don't need it forever. You get your metabolic, you get your weight, down to where that leptin, it's the leptin level that you have to keep an eye on. Where the leptin level is low, like under 20, that's a sign it's time to come off of it. And then periodically you may have to do it here and there, like if there's something going on and you're off track again. But that has seemed to work. Now, we're still new in all of this, so you might bring me back in a year, and I've changed practice strategies. But right now, that's what I'm observing. And
so ladies, they're happy, right?
They're super happy.
So if ladies, you're interested in that is just a great way of discussing it with your doctor. Talk about the microdosing.
Right.
You're not completely opposed to it.
I'm not completely opposed to it. I think, again, when we talk about a holistic approach and bringing everybody to the table, pharmaceuticals aren't bad. They just need to be dosed a little bit more appropriately.
Right.
So,
right.
Yeah.
Now, just to wrap it up, because I just want to hear that reset. What do you give in the book? Yes. What is that reset? How do you? Because I know everyone always. How do I do this? How do I get started?
Yeah.
You give them the reset.
Right. So there's a 30-day hormone reset in the book, and the first 2 weeks are for everyone. It's repairing the gut. Literally what I went through myself, but repairing the gut, cleaning up the liver. Those are your hormone organs. We need those to work well. After those first 2 weeks, then you guys split out, because we're trying to identify your dominant hormone pattern, and there's a quiz and a test to help you do that. And then we start to tailor it a bit, where the next 2 weeks are focused on balancing that particular hormone pattern out. The people that have done the reset with me in my community that I run have literally seen their labs change the following month or two. And then when they fall back off of that, then sometimes they have issues. But that at least sets the foundation. For me, and I say that very clearly in the book, that's the foundation for beginning your hormone healing journey. And then from there, you can make a decision about yes hormones, no hormones, where you need to go next.
Amazing. First of all, there's so much information. Thank God there's somebody out there doing God's work. We're saving marriages. We're saving marriages.
I hope so. Families.
We're saving families, women. I mean, it's just a gentle reminder to women that knowledge is power, that it's not over for you. There is a world where you can look and feel your best. And I think that, again, we've looked at aging, especially in women, as it being over, that it's just, you're just going to sit in your house and become this like crickly old lady.
Yeah.
And I'm like, we have so much experience. So use it, talk to your doctors, get that knowledge, read the books, ask the questions, right? Because there is no reason for you not to look and feel your best. And it does change your perspective and your mood, doesn't it? Because I know you say like emotions affect your hormones.
It's all connected.
And your hormones affect your thing. So when you look good and you feel good, you usually do good.
Yeah,
right?
absolutely. Your life changes. I mean, I think what you attract changes. I think how you present changes. I think that you, and this is getting woo-woo, and I'm a little woo-woo, but you come into alignment with who you're meant to be and what you're meant to do here on the planet.
Agreed.
You know?
Agreed.
So.
And what gets you up and dressed every day? I have to ask you.
My gosh.
What are your happy tools? I have to ask everybody because that's funny when you say your toolbox. I always say your happy toolbox. What are those things that you know that no matter what, you can find your happy in the hard? Even in the hardest of days, what do you do to just like shake it off, get back?
So I have such a toolbox, but I think the one that is the easiest and most consistent is I'm a writer at heart, I think. I love to journal.
Okay.
And I think if I can spend 10 minutes journaling, if I can meditate and sort of clear, my energy, I practice in the active clearing, energy clearing sort of ritual.
Yep.
If I can do those things, if I can pray, then I'm pretty good. And then of course I would add movement of any kind because my job is so like in my head, right? So any sort of movement I do
really
makes
helps.
Me feel better. So whether that's yoga or Pilates, I did hot Pilates this morning, loved it, or walking or weights, whatever it is. But I really commit to moving in some form or fashion every day.
It's medicine. I'm sorry.
It's medicine. And then I think just being in service to my family, to my patients, to my community, to this mission, I think all of those things keep me going.
They do. And so when you look so gorgeous today.
Oh, thank you.
Do you get up and get dressed every day? Or what are your go-to things? Like, do you feel how powerful it is when you look good?
I am not we have a running joke in the family. I believe sneakers are for the gym. I believe yoga pants are for yoga. I get dressed. I like put an outfit together. I try to have my hair in a decent spot. Like I actually put a little bit of makeup on. I just believe that's a ritual in owning ourselves, taking a step towards ourselves. So you won't catch me in any of that stuff unless I'm like truly just running around for a second. But I believe, and I love fashion too, and I love clothes, right? Yeah. So like that's a part of being a woman. Why are we like hiding from that? Own it. Get dressed in the morning.
When did we stop applauding women for looking and feeling fabulous? I was like, we've normalized like miserable, looking like shit, feeling like shit, and not doing shit. And then we mock the women who are happy or healthy or doing well.
Right.
And I want to flip the switch on that.
Totally.
Maybe if you ladies were looking in the mirror, taking a minute, doing a little bit of work, you'd understand why we want.
Well, there's accountability in dressing too.
Yes.
Right? It's easy to hide. Like when I was in the ER, it's easy to hide in scrubs. You can hide for a period of time. You can hide in yoga pants for a period of time. But when you have to put clothes on and an outfit on, it's a form of accountability that's not the weighing scale, right? Or not all these other things. So embrace it. We have always been fashion forward. There is no reason to change that.
Thank you.
Yeah.
Dr. Taz, I love you.
Coming in hot.
Thank you so
You're
much
welcome.
for being here. It's just an incredible conversation. I think it's so important. I just love the way you're tackling it, to be honest with you. Thank God there's women out there talking about it, helping us. And I actually can't wait to start actually making some changes because I do have a lot of like back, joint pain and stuff. And you kind of don't really think about all those little things, right? Because you're feeling good, but there's always a little something you could tweak. There's always things we can be working on.
Definitely.
Right? Definitely. So ladies, we all need the hormone shift. Okay. Where can people find you if people want to come to you?
Yeah.
Tell us everything.
Well, we definitely have clinics here in LA, New York, and then of course in Atlanta. And then we have a big telehealth platform as well if you don't want to travel. But the clinic site is centerspringmd.com. But you can find me, links to the clinics everywhere. I'm on all socials, DRTAZMD, Dr. Taz MD. Lots going on in my world. So you just pick your journey, whether you want to be a patient or you want to read a blog or join my community or whatever it is. But lots of avenues and opportunities to join the conversation.
It's amazing. Thank you so much for being here. I loved meeting you. Loved having this conversation.
Thank you so much.
Thank you.
Of course.
All right, guys, we will be back next week with another amazing topic. Have a fabulous week. We love you all. Thank you for all the love and support. Hope you look and feel fabulous.